welcome back to my channel. My name is Kyra and I'm an accelerated nursing student pursuing my BS in RN. And today we are going to be talking about how I take notes and study for my nursing school exams. So I'm going to split this video up into 3 sections. I'm going to talk about what I do before lecture, what I do during lecture, and what I do after lecture. So to start, before lecture, I know some people say review your PowerPoint, start making your notes before lecture. Personally, I do not do this. I honestly just don't have time to do this. I typically go and look at what the topic is and what the lecture will be about, but I don't really scan the PowerPoint that much in depth, and I don't take any notes before because I find that my professors emphasize certain things that I may take notes on, and then I realize I didn't even need to take notes on that. So I like to go to lecture and get my notes there before making any notes. I only go look at what the subject is and what we're going to be talking about. So now on to what I do during lecture. During lecture, you need to find a way that you take notes best. You can do this with paper, you can do this with an iPad, or you can do this with a computer, or you can just sit and listen. I will go over each of these. Sitting and listening is cool. Some people do it. I know some people do it. They just have their iPad and follow along on the PowerPoint with the professor. Personally, this does not work for me because I forget things and I get off track. If I am not moving my hands in any sort of way, the first thing I'm going to do is grab my phone and start scrolling on my phone. So I can't just sit there and not do anything. I have to have my hands moving in some way, shape, or form, and that helps me stay engaged. Another method is with paper. I don't use paper. I don't do paper notes. I find that with paper notes, it's really hard to not write too much because you want to write down the headings of the slide and then write everything underneath. And then if you're writing down notes that are specific to a specific slide, you don't really know where that notes applies. So I feel like paper is not the best way to go, but if you want to do it and it works for you, that is okay as well. The other methods that I have used, both of them, iPad and computer, they're both great methods. I find that some people really love the iPad and the pencil, and then some people just like to use the computer because maybe they don't have an iPad or it's just their preference. I stand by both. Do what works for you. With the iPad, you can download an app such as GoodNotes. I believe Notability allows you to download PowerPoints, and you can have the PowerPoints on that app, and then you can write in extra notes, make highlights on the iPad. This is a very good way to take notes because you're interacting with the content. You can read all the words on the PowerPoint and still listen to what your professor's saying and highlight important things that they are laying out. And then also you should write notes that they say that it's not on the PowerPoint, but you can tell that it's important. They've either told you that it's important or you just know that it's important. So you write down notes next to the content that they're already talking about, or if they give an example of a term or something, you can write that example on there as well. I do like the iPad. The only reason why I stopped using the iPad was because for some reason my PowerPoints stopped downloading properly and certain words were not on the PowerPoint. And I was getting super annoyed because I was having to fill in so much extra information. And I was like, I'm not doing this anymore. I didn't have time to figure out why it wasn't working. I'm that type where I just don't fix stuff sometimes if I don't have the time to do it at that moment. So I just went back to the computer, and the computer worked for me for my last semester and now this semester. So I'm just going to keep doing that for now, honestly. But iPad is great. With the computer, if you just want to take computer notes and type, I will say that this is a little bit faster if you're a faster typer. On the iPad, you do have to handwrite. So sometimes you can miss things if you're taking too long to write things down. With the computer, you can type faster. So on the computer, I like to download the PowerPoints from the D2L, and then I usually make highlights directly on the slides. And then I also type in the slides next to what is on the slides if they add something that is not on the slides. If they give a long drawn out example or a long drawn out explanation, I go to the notes section and I write that down in the notes section. So the computer is very helpful. It keeps me engaged because I'm still using my fingers. I'm able to read the PowerPoints and follow along with the professor. And I really like that note-taking method. So during lecture, with whatever note-taking method you take, make sure you are engaged, you are focused, and you are taking down really good notes and making key notes of things that they highlight, they tell you need to know it, or they emphasize it multiple times. Make sure you pay attention in class, because that's where you're going to start figuring out what are the test questions going to be, what do they want me to know. So that's what I do during lecture. Now I'm going to talk about what I do after lecture, and this is where the studying process truly begins. So after lecture, there are multiple steps. What I do after lecture all the way up until exams. So after lecture, within 1 to 3 days, this is very important because you want to make sure that the information is still in your brain. I say 1 to 3 days. Some people say the night of, the next day. I'm sorry, the night of, I'm tired. I'm not doing anything else the night of after lectures. The next day, I sometimes have clinicals the next day. I can't touch the homework the next day. So sometimes it's going to be within 1 to 3 days, but really try not to make it go too far out if you can. But within the 1 to 3 days, you want to make a condensed study guide. This is what I do. This is what works for me. And I think it would work for y'all too. It takes time, but this is what helps you study and get this information in your brain. So I make a condensed study guide. This can be either typed or written. For the most part, I mostly do a full typed study guide of the lecture that we did the lecture prior. And with these typed study guides, I'm able to condense sometimes 100-point slides into 3 to 5 pages. This really helps when it's time to study and start doing your active recall, which I'm going to talk about later. It helps to have all the information in a very condensed format, so you're not flipping through slides trying to find the information. With this condensed study guide, you have everything written in its simplest form in a way that is understandable to you and in your own words. And you can also add in pictures, graphs, tables, anything you need to add in that's from the PowerPoint slides, or you can even make them for some of the lectures that may look better in a table sort of format. So like I said, I mostly do typed study guides, but you can also do a written study guide as well if that is how you see fit. The one thing that you need to make sure you do, whether you're doing a typed study guide or a written study guide, you need to make sure that you are studying while you are making the study guide. Don't just aimlessly write down all the notes or type all the notes onto your computer without really engaging with the content at the same time. So when you're typing or writing these things down, make sure you're rereading it and trying to understand what you're writing down before you even write it, because this will make sure that you are actually studying while you're doing it. Because a lot of people will say that rewriting notes or doing this sort of type of study guide is passive learning. But I have found for myself that if I engage with the content while I'm making the study guide, it's actually still helping me get the information into my brain. So this is like the first step to get this information in your brain and making sure you're understanding what you are even making a study guide about. So I am going to show you guys how I make a study guide, and I'm going to show you some other previous study guides that I have made in the past. So this is an example of musculoskeletal that we learned in OB Peds, and this is literally 2-page for one PowerPoint that I think was about 40 slides, 30 to 40 slides. So I was able to fit it onto 2 pages, and this is why I like utilizing this method, because everything is concise and you can see everything very clearly and make it very organized. So I like to utilize bolding so you can have your headings. These are typically the headings that are on the PowerPoint. So bone health, pediatric bone, types of fractures. Under types of fractures, I would go into bullet points so I could see that these are the different types of fractures. And then I bold really important things or even make highlights on certain parts that I know are very important that the instructor emphasized. I also like to take pictures from the PowerPoint that are very helpful. Not every picture, but some pictures. So I would go to the PowerPoint, I would click on the picture, do Command C, and then I would go into the PowerPoint and go Command V. If you have a Mac, this would put the picture in your study guide. I'm going to take that one out because I don't need to use that one. That was just for an example. But with these pictures, you can go to picture format up here and you can actually change the sizes of them to the size that you need it to be. I don't need it that big. And you can make it as small as you want it to be. But I think I wanted it this size. And to get it over here, typically your pictures are going to come up to the left. But to get it over here, you can change the positioning of it and put it where you want it. Once you change the position, you can now move it all around where you want. But I typically put it next to the information that I was just talking about. So Buck's traction is over here, and this is a picture of Buck's traction. This helps me see it in a different way and make the connection to what was being talked about on the PowerPoint. Other things I like to utilize is arrows on PowerPoint. If you do, so this is the symbol that's going to be at the end. If you do dash dash in that symbol, it turns into an arrow. So this helps to keep everything condensed because I like for a lot of my things to just be on one line. I don't like them to go to the next line. I like to keep it as condensed as possible. So this says osteomyelitis causes is an abscess in dead bone. So osteomyelitis is abscess dead bone due to infection that leads to, so basically the arrow typically means causes or leads to malaise, fever, edema, all that stuff. So I didn't want to give the signs and symptoms its own line because I was trying to keep everything on one page. So utilize arrows, keep things concise, use your commas. You don't have to write complete full sentences if you understand what you're talking about for yourself. And then use short form. So DX is diagnosis, NC is nursing considerations, CM clinical manifestations. So just try and figure out a way to make it shorthand so that you understand it. And yeah, this is what my study guides look like. Here are some other study guides. It's all pretty similar. Yeah. And besides that study guide, I also like to make tables. So for complex health, which is also known as med-surg, I made a table for the endocrine system because for every single condition, we needed to know clinical presentation, main cause, diagnostics, nursing management and treatment, and care priorities and education. So I found that this table was very, very helpful for at least the endocrine system because it helped me see the differences between each of them and the similarities. You can take it a step further and do highlights so that you can see the clear differences and know what you need to know for the exam. But this is another way to organize your information into tables. So after you make your study guide, I told you study guides need to be made within 1 to 3 days after lecture. This does not necessarily mean that you need to start studying this information consistently before your exam. I am the type, because I'm in an accelerated program and this program is fast, days are very, very busy. I don't have time to study every day. I don't have the time to look at this information every single day of the week until exam day. Because say we're learning 4 lectures over 4 weeks, a whole month, it's too far out for me to look at lecture 1 every day until the exam. So what I like to do is every week I do try to look at the information at least a little bit, but I don't go into full on study mode until anywhere from, I'm gonna be honest, anywhere from 1 to 5 days before the exam, because some classes are easier than others. Mental health class, psych, that was a pretty easy class for myself. So I only studied 1 to 2 days for most of those exams. And for that class, I really just read the study guides, did a little bit of active recall, and I did fine in that class. Other classes, you might need 5 days to a week. Complex health, the med-surg, OB-peds, you might need more days to study for those classes. So really figure out based on the content that you've learned and the knowledge that you have about this content, figure out how many days you're going to need to study and figure out what you're going to study on each of those days prior to the exam. I like to study by PowerPoint, so I usually go over a whole PowerPoint each of the days, because remember, at this point, I've already made my study guide and it's only 3 to 4 pages, maybe sometimes 2 pages for a PowerPoint. So it's not so much information that I can't go over a whole topic in one day. So I plan out what I'm going to do for each of those days, and that's how I plan. Once I'm done planning, now I begin going into a deeper dive with studying. With studying, sometimes I will rewrite notes in a more simpler version with the most pertinent information that they need to know out of me. For example, I'm going to show you guys a picture of one of the study guides that I made and then what the rewritten notes look like here. So this is an example of how I take my study guide and then I further write it down into a condensed format. So on the study guide, I have a little bit more information because this is what I created from the PowerPoint and I had a lot more information, but I realized you don't really need as much of the information, like cancer causing headache, vomiting, dizzy, blurry vision. Those are things that are a given with cancer. So I further condensed it into written notes where I put the most pertinent information, like the hallmark sign of each of the types of cancer that peds get. And then I would highlight the parts that I know they want us to know. I knew they wanted us to know the difference between Hodgkin and non-Hodgkin is Reed-Sternburn cells. I knew that they wanted us to know the difference between the two bone cancers are sunburst sign versus the onion skinning on the bone scans. And then like for kidneys, do not palpate. It will rupture for Wilms tumor. So these are the big things that they wanted us to know. So take it from your study guide. If you feel like your study guide is too broad, you can even just narrow it down on the study guide. But I like to rewrite as well because I feel like rewriting is another form of studying and using a different portion of your brain to get the information into your brain. So this is an example of that. So as you can see, sometimes rewriting the notes in a more concise way helps you filter out the information you don't need and keep the most pertinent information on the study guide so you can remember those things for your exam. Besides rewriting notes, I like to do the blurting method. With the blurting method, that is when you're just speaking aloud the information to yourself. You're not necessarily doing active recall because you can still have the paper in front of you. So I'll show an example of what the blurting method looks like right now. So this is some notes I have about cardiovascular. This was from Patho. Okay, so for the blurting method, this is something that the blurting method would look like. Okay, vasoconstriction causes increased BP and vasodilation causes decreased BP. BP equals cardiac output times resistance. And cardiac output equals heart rate times stroke volume. So cardiac output is the amount of blood that is pushed out of the heart with each heartbeat. So as you can see, I'm looking up and down, trying to memorize the information. I have not memorized it yet, but I am working on it. So I'm looking down, but I'm looking up and trying to see what I can remember. If I don't remember, I just go back and look down. Over time, you're going to start remembering the information more. The more you work with it and you make sense of it in your brain, you're going to get this information down. So I highly advise you to start off with reading your notes fully through and then start blurting it out and looking up and down, trying to see what you can remember. And then you will get to the final step where you do active recall. With active recall, you need to make some sample questions and then you need to answer said questions. So I like to just figure out what am I learning about? I'm doing cardiovascular. So what is cardiac output? That's a question. What is the formula for blood pressure? What are baroreceptors? What is arteriosclerosis? What is atherosclerosis? So I would just type these questions down on a Word document and then I would use that document to go answer questions on paper if I didn't have access to a whiteboard, or I would just answer them on a whiteboard because I really like to see the information very big and bold. So for that day, I would go over a whole PowerPoint and get all this information on a whiteboard. After doing active recall, you can check all your answers and stuff like that and see what you don't know. What you don't know is what you keep asking yourself. Keep trying to figure out why you're not understanding it and keep going over it. So that is what I do. Also, after you have felt like you got the knowledge in your head, you've done your active recall, you're really getting the information, you should probably try to do some practice questions. If your class professor has practice questions available for you, I suggest you to use them. If you find that during the first exam, the practice questions are nothing like the exams, you don't really have to use those practice questions, but it still helps to have some type of question to see if you're understanding the information well. So those are my tips on how I take notes and how I study. I hope this was helpful to you and that you are able to be successful in your note taking and study techniques. If you need some more help with this, I can always go more in depth or answer specific questions. So leave your comments and questions down in the comment section down below. Like, comment, and subscribe. Share this video to a friend and another friend and another friend and another friend. And I wish you guys all the best on your studying and exams in nursing school. See you guys in the next video. Bye.